Question, the member from Ottawa Centre.
My question is for the Minister of Health and Long-Term Care. Over the past few months, I've had a number of constituents in my riding who have had some difficulty getting access to the medication they need. Speaker, one drug in particular is Avastin, a first-line chemotherapy drug used for the treatment of colorectal cancer. Funding began last year for this expensive drug, but it was limited to a number of cycles, which was extremely difficult for people struggling with this cancer and their families. Speaker, I understand a decision has recently been made to expand access to Avastin. Could the minister please explain how and why this decision was made?
Sure.
Oh, thank you, Speaker, and I must say that we are extremely pleased that we have struck an agreement with the drug manufacturer that will enable our government to make Avastin more widely available to those who might need it here in Ontario. It's very good news. Speaker, we have the clinical experts who sit on the committee to evaluate drugs. They are charged with a very serious responsibility of making decisions on drug funding based on clinical evidence and cost effectiveness. Back in May, the ministry initiated discussions with the manufacturer around the funding of Avastin. These discussions accelerated in light of requests the ministry received for patients to continue treatments past the cycle cap. I'm very pleased that the ministry has reached a new agreement with the manufacturer which lifts that cap and allows funding to continue if a patient is responding well to the treatment. We'll continue to make progress for Ontarians with cancer.
Supplementary.
The expansion of access to Avastin is good news for Ontarians fighting cancer. However, Mr. Speaker, there are many other types of cancer that Ontarians are struggling with every day. Cancer touches us all. It affects our parents, our children, our brothers and sisters, and many other loved ones. We all need to rally together to fight cancer. Speaker, can the minister please tell this House about any other steps the government is taking to support Ontarians in their fight against cancer?
Thank you, Speaker. We have made good progress for Ontarians suffering from cancer. We introduced Bill 102 to get better value for money and to give patients better access to the medications they need. Since 2006, we've added 28 different drugs to the formulary, and since taking office, we've almost tripled funding for cancer drugs. And in an initiative that is so very important to people with cancer and their loved ones, we're bringing down wait times for cancer surgeries. We're building more capacity. Just last Friday, the addition to the Ottawa Hospital's Cancer Centre opened, which in combination with the Queensway Carleton development will serve 1,300 more people each and every year. Speaker, we're expanding cancer prevention and screening programs. We launched Canada's first province-wide colorectal cancer screening program. We're funding more than 130,000 colonoscopies over 5 years. The Ontario Breast Screening Cancer Program will reach 1 million participants this year.